Malacañang is planning to further ease quarantine restrictions across the NCR Plus bubble by June 15. To give us his insights on this, we have OCTA Research Fellow Professor Guido David joining us over the line. Good evening, Professor Guido. Do you agree with Palace spokesman Harry Roque that the numbers in the region are looking good?
Hi, Sean. Good evening. Actually, we do agree that the numbers are still improving. We know that because even though the previous week we had a slight uptick in cases in the NCR, now we're back on a downward trend. The reproduction number in the NCR is 0.68, and we have a one-week growth rate of, I think, about minus 12%. So that's a 12% improvement over the previous 7-day average. And the positivity rate's below 10%, and numbers seem to be improving, and we do agree that, with the assessment of Malacañang.
All right. Now, while the numbers may seem to be improving, or they are improving at the moment, does this warrant that the GCQ with restrictions that is supposed to last until June 30, does it warrant it being shortened until June 15, or should we stick with the original target of June 30?
Well, I think that they can definitely consider easing restrictions. I believe that the plan is to keep the NCR Plus still under GCQ, but with, let's say, less restrictions. And I believe that's in line with the strategy of gradual easing of restrictions in the NCR Plus. And my understanding is that, as far as we know, they'll be planning the health protocols for these business establishments that will be reopened. And we are aware, and we do trust that the Association of Business Owners will do this and plan this in a safe manner, because so far what we have seen during the months of GCQ with the restrictions and with MACQ, that there have been no significant community transmissions in business establishments.
All right. Now, what about gyms and other indoor establishments? Authorities have been saying these are next in line to reopen, as well as other indoor activities, of course, at limited capacity. Are we really ready for this? I mean, we just logged another 7,400 cases today.
Well, that's true. We did log 7,000 cases today, but so far we're only logging less than 17% of that in the NCR. So the numbers in the NCR are still improving. We're averaging less than 1,000 cases per day. We consider NCR to be in the moderate risk classification. So although there will be risks involved when we reopen certain businesses, like I said, at some point, we can't stay in lockdown forever. So at some point, we will try to have to reopen some businesses. So let's just hope that no community transmissions will occur. And we're hoping to receive a significant number of vaccines this month and the next month. So we hope that in that race, we will be able to vaccinate a sufficient number of people, because with 20 million people we're set to receive, we may be able to achieve close to population protection actually in the NCR based on my calculations.
Right, so you did mention only 16% of the 7,000 plus cases logged today are in NCR. Where are the bulk of these other cases? Are they well distributed among the provinces, or is a bulk going to certain areas of risk right now, such as Davao City?
Well, a bulk of the cases are actually occurring in parts of Mindanao and parts of Western Visayas. And Western Visayas will also include Dumaguete, which is in Central Visayas technically, but it's fairly close to that region. So we have 3 hot spots in that region. So that's Bacolod, Iloilo, and Dumaguete. And in the Mindanao region, we have Davao City and a few other places like Cagayan de Oro, General Santos, Coronadal, Cotabato City. Although when we last checked yesterday's numbers, the trend, the upward trend seemed to have slowed down in the Mindanao area, but it's still increasing significantly in the Western Visayas region.
All right, and one of the big things that we fear in all of these rising cases are, of course, new variants. Guido, do we have any more clarity on the reasons behind the surge in Davao as well as other provinces in the Western Visayas and Mindanao? Is it really due to another strain?
Well, that's something we would be afraid of, Sean, but unfortunately we don't have information yet if whatever's driving the surge in Mindanao and Western Visayas is the old variant, the UK variant or the South African variant, or if there's a new variant. I believe, based on to the best of my knowledge, we don't have information yet on these. Hopefully we will get some genome sequencing soon, but definitely whatever the variants are spreading, people should be very careful when they're in these areas and should practice the minimum health standards.
Right, always sticking to those minimum health standards. Thank you for your time as usual. That was Professor Guido David of the OCTA Research Group over the phone. Thanks, Guido.